Hello and welcome to another exciting and educating edition of Health and Fitness Show. I'm your host Fahad Matin, and today we are very happy that we are back online. Unfortunately, there was some kind of a problem with my music. Somehow the music just got disappeared. Anyhow, I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. This program is broadcasting from the platform of Inspire FM today on 28th of October 2021. Wow, the year has passed really quickly, and casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton, like Dunstable, Harpenden, and Bedford. Our positive airwaves going through our online online channels as well, which is the Inspire FM app and website, and also you can view us on Facebook live or of the Inspire FM link, or YouTube channel of Inspire FM link. So as we all know, we cover different health related topic every single week. So today is something in the same line. Today we are talking about a very important topic, and this is a topic which people always say, uh, if you ask them what is your health problem, and they always say, oh, bit thodi si sugar hai. And definitely sometimes people take it very lightly, but definitely this is not a light matter to take. And definitely when we are talking about shows and when we talk about things, so the topic for today is diabetes and the problem in our community. Yes, you have heard me correctly. We are talking about diabetes and the problem of diabetes in our community, and I'm not the one who will be talking about today's show. This show has been. I have a very lovely guest and a very dear and near brother, friend, doctor of mine, and he's none other than Dr Adil Ali-Khan. Assalamu Alaikum, Dr. Saab.
Walaikum Assalam, Fahad. It's a pleasure
How
to
are
be on
you?
your show again. Pleasure and privilege, I must say.
The pleasure and privilege is mine, sir. It's always nice to have you on the show. और जब भी आप आते हैं शो में एक चार चांद नजर आते हैं तो आप देख सकते हैं खुशी से मेरा चमकता हुआ चेहरा आपके सामने.
Subhanallah.
Well, just to involve our guest as well. So if you have any questions or queries regarding our topic tonight, please do give us a call. Do send your text messages or WhatsApp on 07779481822. I repeat, 07779481822. Or you can send your text messages or WhatsApp you can send your messages via our Facebook apps as well. Send your message by Facebook app, and definitely we will be responding to you. So let's come back to our show tonight. As we all know, we always start our show with a bit of introduction, but everybody know Adil for multiple reasons, for multiple ways, shape, or form. They know Adil from a GP perspective. They know Adil from a sports doctor perspective, the boxing rings. People know Adil as a doctor who normally provide other services as well in the community, and he's a multi-talented singer as well, but we are not asking him to sing today. But a quick intro will be nice for our listeners and viewers who are seeing us or viewing us for the very first time. Adil?
Well, I was about to break into a song called Meshair To Nahi, but I better stop just there.
Yes, indeed. Otherwise we will be in problem.
So we're talking about diabetes today, which is an illness which
But a little bit of introduction from you first.
Oh, myself or?
Yes, about yourself.
Right, my name is Adil Ali-Khan. I've been a GP in Luton since 1992. I have a great interest in diabetes because it affects so many of our patients, and we really need to educate our community about how important it is to treat it properly and not take it lightly. Because if you take it lightly, the problem with diabetes is once things go wrong, the problems that arise are nearly always irreversible. That means they cannot be reversed. and you're going down a very steep, slippery slope. So it's very, very important to understand the nature of what this illness is and exactly what you can do about it, because you've got the power in your hands. And if you educate yourself, education is power, you can do something about it and you can keep in control. I suppose the one problem with diabetes, it's not like a broken arm. With a broken arm, you can see it, it's in front of you, and you can do something about it. You put a plaster on it and take painkillers, and slowly but surely it gets better. But with diabetes, very often it's what we call insidious. It can actually get worse within you without you even knowing sometimes. Then suddenly, by the time it does present, it can present with all sorts of problems to you. So basically with diabetes, there are two types. There's type 1 and type 2. So type 1 diabetes is a form of diabetes where your body actually attacks the cells which actually make your insulin. So your insulin, which is a hormone, is made within a gland in your body called the pancreas, and your body actually attacks those cells so it doesn't produce insulin. Now, insulin is very, very important because what it does, it helps the cells in your body, every single cell in your body, take glucose from the blood into the cell for it to function. Now, glucose is literally the petrol which drives the engine for all your cells. So if your car is without petrol, it just doesn't work. Similarly, if your cells are not able to take up glucose, they stop working as well. So this is why insulin is very, 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 very important. Type 2 diabetes is a condition whereby your pancreas produces less insulin than it should do, and or the insulin just doesn't work very well at the end point, at the cells. With type 1 diabetes, you tend to get this developing a lot earlier in age. It tends to occur in people under the age of 40, and it's got genetic links as well. It tends to run in families. With type 1 diabetes, you can actually develop the symptoms very, very, very quickly, and the symptoms are generally a lot of thirst, passing urine a lot, feeling very tired, lethargic, and losing weight. So these are very, very important symptoms to pick up on. With type 1 diabetes, you can develop these symptoms very, very quickly, and we've had incidents of some patients who just turn up in hospital feeling really, really ill and almost go into a coma, and that can be their first diagnosis of type 1 diabetes. Type 2 diabetes tends to develop very, very, very slowly. Again, you will get the thirst, you will get the passing of urine quite a lot. You may get a slow decrease in weight. You will get feelings of very tired, lethargic. You may present with various infections as well, like thrush, like a lot of fungal infections around your armpits, your genitalia. Type 2 diabetes has a correlation with your ethnic origins. It tends to be a lot more prevalent in South Asians like us. It tends to be made worse if you are overweight, you have a lack of exercise as well. And if you do have a family history of type 2 diabetes, you can be genetically predisposed to it as well. So this is why it is actually very prevalent amongst us Asians. I think the overall incidence of diabetes in England would be just over 10%. Amongst Asians, it is a lot larger. Within our practice, we have a very large Asian population, so the prevalence of diabetes within our practice is just under 14%, which is quite high compared to the general population.
So is it very, very common in Asians? Because one of the things which people think that, or just like the way I've said it in the beginning, when you ask them, "Are you diabetic?" Their very first reaction is no, and then you ask them, "Sugar, eh?" And they said, "Yeah." So why there is a difference in connotation and language understanding?
Well, I think I think we've got to understand if you're a diabetic, you are diabetic. End of story. Okay.
Hmm.
A lot of people say, "Oh, I'm a little diabetic." And therefore, what you're doing is taking the importance of the diagnosis away. And I think that's very, very, very dangerous because once you start doing that, you don't treat it properly. You don't treat it seriously. Okay.
Hmm.
The cornerstone of treatment of diabetes is diet. And, it is very, very, very important. If you're diabetic, it is fundamentally important to know what a diabetic diet is and to stick to a diabetic diet lifelong. It is very, very important because without sticking to a diabetic diet, okay, you are going to be taking in far too much carbohydrate, and that's going to elevate your blood sugars, and you're going to be on a hiding to nothing. So if you've got an inadequate diet, if you're taking in too much sugars, the medication you would take for your diabetes just will not work at all. It will not work. Your blood sugars will go high, and then you are left with the side effects of diabetes and the consequences of diabetes. And the consequences of diabetes, if it's left uncontrolled, can be very, very disastrous and it can be life changing. So, what diabetes can do in the long run, it can affect your kidneys, whereby your kidneys slowly um, lose their function. It can affect your blood vessels. Your blood vessels start clotting in various areas, so you can start losing the blood supply to your arm, to your legs as well. And you may hear incidences where people who are diabetic have to have amputations because they've lost the blood supply to their legs. So this is a very, very real consequence of diabetes. If you are diabetic, you do have a higher chance of heart attacks. You've got a higher chance of stroke as well. So these are things which are very, very important. And this is why we need to take this disease very, very, very seriously. So if you're diagnosed as diabetes, you do not say, "I've got a little diabetes." You are diabetic. So you need to take it seriously from day one.
So when we talk about seriously in day one of management, if diabetes are not controlled, how do we know that it's not in control, and plus how can we manage it? Because one of the problems which we have is that, just like you said, people do not realize that it's not nothing to do with little diabetes. Either you have the diabetes or you don't have the diabetes. So how do we pursue the proper management, and what are the effects? Because one of the things people, because when you have fever, and this is a common example that somebody asked me, if you have a fever, you normally take paracetamol because you are having a fever. If you have a problem in the if you have a pain in the stomach, you have some kind of a painkillers. But with diabetes, when you're diagnosed with diabetes, doctors give you a bunch of medications, and you're taking medications, but you don't feel like there's something wrong with you. So just for people knowledge, a, what are the problems you face, what are the effects of diabetes, and b, how can we manage it?
Okay. So the diagnosis of diabetes is made by a simple blood test.
Hmm.
Okay, so your blood test will tell you whether you have high sugar levels or not. And if you've got high sugar levels over a certain threshold, that's the diagnosis of diabetes.
Hmm.
Then you go on to the treatment. So for type 1 diabetes, as I said, you're not producing the hormone insulin in your pancreas at all. So therefore, you will need a hormone replacement in the form of insulin. So for type 1 diabetes, you'll need insulin injections for the rest of your life. Type 1 diabetes cannot be cured. That's something we've got to understand and realize. Once you have type 1 diabetes, you've got type 1 diabetes. Type 2 diabetes, as I said, is a condition whereby your pancreas is not producing enough insulin, or the insulin and or the insulin is just not working very well at the end organ of the cells. So for type 2 diabetes, you need to maintain your calorific intake of carbohydrate, and you will need to start medication. Most people do need to start medication in the form of tablets. Okay. Now, you will need to monitor your blood glucose levels at regular intervals. If you're on type 1 diabetes, you'll be taking blood tests at home on a regular basis. With type 2 diabetes, you don't always have to, but you do need to regularly visit your GP, and he'll do regular blood tests, which will look at your blood sugar levels, which will look at your cholesterol levels, and look at your kidney function as well. For both illnesses, you will have to have regular checks at the eye clinic. And once a year, you will have to have what we call retinal screening. As I told you, that there are various organs which can be damaged by diabetes, and one of them is your eyes. And diabetes can cause irreversible changes in the blood vessels in your eyes. So once a year, all diabetics have to have what we call retinal screening, whereby photos are taken of the blood vessels at the back of your eye, and we can detect early changes and do something about them before you lose your sight. So we can be very, very proactive, and diabetics should have this done every year. Your GP will also organize foot examinations on a yearly basis. So the nurse at your practice, she'll be looking at the blood supply to your feet, and she'll be looking at the nerve supply to your feet, so she can detect early changes of blood supply and any nerve changes to your feet, because diabetes can also affect the nerve endings, and if your nerve endings get affected, you will not be able to feel things. So there are diabetics who we had an instance whereby we had a gentleman who was diabetic, didn't realize he had a toy car in his shoe, and he did not realize that because he couldn't feel it.
Toy car?
Yeah, a little toy car in his shoe, and he could not feel it, and this ended up causing him an ulcer. And nobody knew why he developed this ulcer. It was because of the pressure in his shoe. And because he couldn't feel it, nobody knew whatsoever. Nobody knew whatsoever. So these are reasons why this is very, very, very important. Very, very important indeed.
Wow.
Now, you need
that is amazing. Yeah.
Yeah, you need blood tests at regular intervals to make sure that your blood sugar levels are being under control.
So when you said regular intervals, that means every 6 months, or every year, or every month?
If your diabetes is not under control, the blood tests at your GP would be done every 3 months. If they are under control, it's generally every 6 months. And that'll show that you're keeping everything under an even keel. And it's very, very important to maintain these regular appointments with your GP. What we do find in our community, unfortunately, is that once a few patients, a certain number of patients are told that their diabetes is under control, they start going back to their bad habits. They start eating whatever they want to do, or they even stop their medication, thinking, "Oh, my diabetes is under control, I can stop my medication." And this can be an absolute disaster, because you can actually lose all the gains you've made, and you can get back to square one. And so when your diabetes is under control, it's very important to maintain those changes in the lifestyle that you've done and you've worked so hard to maintain as well, and to carry on with your medication. Now, type 2 diabetes cannot be cured, but type 2 diabetes can go into remission. Now, what this means is that if you control your weight, and if you're overweight, if you can decrease your weight, you can bring your blood sugar levels down, and you may be able to come off medication totally.
So that means a person can live a normal life, but you said medication is something which you should not come off from.
Well, no, if you can control your blood sugar levels and show that they are being controlled, if you're a type 2 diabetic, we can slowly decrease your medication. And you may
Hmm.
get to a point where you can come off, some people come off with their medication. Okay.
Hmm.
Your diabetes is not cured. This is what we call in remission.
Hmm.
You may reach a stage where your blood sugar levels may start coming up again in the future, and you may have
Hmm.
to restart your medication. But with type 2 diabetes, some people can control it to the point where they can come off their medication. They
Hmm.
still need to be monitored because in the future their blood sugar levels could come up again. They still need to be monitored on a regular basis, and they still need to maintain their lifestyle. I've
Hmm.
got to note
And
this is
as you
not a
mentioned,
cure. This is this
hmm
is this is a condition whereby your disease is in remission.
hmm so as you said, a person can come off from. You have to reduce your weight and have a healthy lifestyle. So when we talk about healthy lifestyle, we automatically think about diet and exercise and so forth. So is there any specific diet for diabetic patients, or any exercise they have to do it on a regular basis?
Yeah. Well, I mean, diet, as I said, is the keystone of diabetic treatment. And basically, if you go onto the Diabetes UK website now, they
Hmm.
have diets for all ethnic groups, and it's just absolutely amazing the amount of information on the Diabetes UK website. If you are diagnosed diabetic with your GP, he'll be able to supply you with leaflets about diet. You'll be referred to the Diabetic Education Centre as well. And again, information is power, education is power. If you have that information and you follow the guidelines, it will help you no end. It will help you no end. So basically, what you're trying to do is to decrease your control your carbohydrate intake.
Hmm.
Now, a lot of people who are diabetic think, oh, if I just cut out my sugar, that's good enough. But it isn't that, because we have hidden sugars in what we eat.
Hmm.
So the hidden sugars could be in bread, it can be in pasta, it can be in roti as well, and all these things in naan. So these are little things that contain carbohydrates, which get converted into sugars in your blood. So it is very, very, very important to know exactly what you're eating, the amount you should be eating as well, and this should be controlled. So
And I
yeah, you were
must
saying.
say, yeah, I was about to say that yes, sometimes it's really hard. I absolutely agree on that, because one day, due to my work reason, I end up in one of the diabetic UK patient group, where one of the diabetic nurse was giving them advice for Christmas treats and so forth, and the food options and things which were there for those people was something very, very hard for me to digest. I must say, I just had a look and I said, oh my goodness, how can people be on these kind of thing? But yeah, I absolutely understand, it is what it is. And on that note, I must say, wow, the time has passed really quickly. We are just about to approach our break. So when we come back from the break, I will ask Dr. Adil Ali-Khan about a bit more. What are the common signs and symptoms people who are not diagnosed with diabetics? How can they find they are? How can they control their ones? And then there are some myth-busting questions, because our community love myths and they work on myths. So we will be discussing certain myths, and we will talking about those. So stay tuned. We will be right back after these very short messages.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
AsSalamu Alikum, this is Omar Regan.
I'm Amir Khan.
My name is Iram.
My name's Hamza Fletcher.
My name's Chris Nichols.
My name is Ali Imdad.
This is Atik, No Comment Malik.
I am Saundra Glenn.
Tolly Martins.
This is Naeem Raza.
My name is Mohammed Asman.
My name is Atya.
My name is Julie Steaky.
My name is Dawood Masood.
This is Rizwan Hussain.
This is Moses the Comic.
My name is Suhaib Web.
My name is Shazia Salim.
This is Baba Ali.
My name is Sheikh Hafs Al-Ghazi, and you're listening to Inspire FM 105.1 FM.
Biscott Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscott Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our Stop Smoking service. We're open 7 days a week till late, including bank holidays. Biscott Pharmacy, 157A Biscott Road, Luton. Call 457709.
As-salamu Alikum. Bismillah. قال النبي صلى الله عليه وسلم من رغب عن سنتي فليس مني, that whoever abandons my sunnah is not from me.
Why do Tops Pizza deliver the top pizzas in Luton and Dunstable?
For a start, all the toppings are 100% halal and Tops use fresh dough every day. Then there's the cheese, the highest quality available. And when it comes to food preparation, cleanliness is taken as part of our faith. So that just leaves the taste, choice, and great offers, including buy one, get one free on all medium, large, and extra large pizzas. Tops Pizzas, Wellington Street, LU1 5AA. Order online, topspizza.com or via Just Eat. Download our app or call 01582 72 5000.
Luton's most luxurious venue for Asian weddings is now bigger and better than ever before. With 2 venues to choose from, Venue Central can provide the ultimate setting for your wedding. 2 huge venues, 1 high standard, right in the centre of Luton. Visit us online today at venuecentral.co.uk or call us now on 01582 451 767. Venue Central, affordable luxury in a central location.
الحديث الرابع عن أبي هريرة رضي الله عنه قال قال رسول الله صلى الله عليه وسلم قال الله يسب بنو آدم الدهر وأنا الدهر بيد الليل والنهار رواه البخاري وكذلك مسلم.
Hadith 4. On the authority of Abu Huraira, may Allah be pleased with him, who said that the Messenger of Allah, may the blessings and peace of Allah be upon him, said, Allah said, sons of Adam, inveigh against the vicissitudes of time, and I am time. In my hand is the night and the day. It was related by Al-Bukhari, also by Muslim.
1 in 4 people suffer from mental health issues.
But in our community, it's a taboo.
लोग क्या कहेंगे?
ये तो साड़ी बेइज्जती है.
Is Allah subhanahu wa ta'ala punishing me?
क्या मेरे पर किसी ने जादू कर दिया है?
Let's break down some barriers and start talking about it.
Join us on Mindful Moments on Fridays at 5 p.m. to learn about how we can support our mental well-being.
Mindful Moments. Let's give our minds the attention it deserves.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host Fahad Matin for today's show. And today we are talking about diabetes and its effect in our community. Definitely. With our lovely guest, Dr Adil Ali-Khan. Assalamu alaikum, Dr. Sahab.
Walaikum assalam.
This program is broadcasting live from the studios of Inspire FM today on 28th of October 2021, and the time has just gone past 6:30. And our airwaves are going to all the lovely people of Luton and the surrounding areas of Luton, like Dunstable, Harpeth, and Bedford, and definitely from our online platform as well, which is Inspire FM app, website, as well as videos are going live from Facebook Live and YouTube channels of Inspire FM. I welcome you back. So before we went on break, we were talking about the diet options of diabetic patients. That what can we eat and how can we eat, and definitely who is better to tell this side of the diet advice other than Dr. Adil Ali-Khan. So, Doc, when we talk about diet, is there any specific diet or any specific food which people who are diabetic can or can't eat? Because one of the very awkward myths, and when we talk about myths, I will raise it up, but is that there are certain things you should eat and there are certain things you should not eat. So in terms of the diabetic patients, what are the best diet re-advice you will give, and how a patient can take it on?
Yes, thank you, Fahad. So when you are diabetic, what you are aiming to do is to control the amount of carbohydrate you're taking into your body. And as I said, carbohydrate can be found in many different foods in our diet. A lot of diabetics, a lot of people who don't know much about diabetes, I should say, think that if they just cut out sugars, that's good enough, and it isn't. And some people think that if they cut out all sugars and all carbohydrates from the diet, that's good. And that's not good either, because our body needs a certain amount of carbohydrate to keep it going. Remember, the carbohydrates gets turned into glucose in your blood, and the glucose is the petrol for the engine. Okay, the glucose goes into your blood, into your cells, and it drives your cells and helps them to work. So it is important to have a certain amount of carbohydrate in your daily intake. And the amount depends on your age, your weight, whether you're male or female. So that is why it's very important to go on these websites and you can actually look at the amount of carbohydrate you should be taking. It is very important to have a balanced diet. It's very important to have the right amount of protein in your diet. It's very important to have the right amount of fiber in your diet in the form of vegetables, which will supply with all vitamins as well. Together with this, it is so important to exercise. And the exercise for diabetics is so important. Exercise itself helps to decrease your blood sugar, because when you're exercising, you're utilizing the glucose in your bloodstream. It exercises your cardiovascular system, so your heart is healthier, your circulatory system is healthier as well. And exercise gives you a feel-good factor as well. So it's very, very important for that reason. Also, it's very important to keep a very good fluid intake. A lot of people don't realize keeping up a good fluid intake is so important, because this is going to be healthy for your kidneys. It's going to be healthy for your brain function as well, because as soon as you become dehydrated, your brain stops functioning as efficiently as it should do. So these factors are very, very, very important as well. And as I said, it's very important that if you are initiated, if you are started on medication, to take it properly and take it in a timely fashion. One thing I must stress also, Luton has got a very, very high number of people who work as taxi drivers. Now, just because you're diabetic does not mean to say you cannot drive a taxi. You can drive a taxi if you are diabetic. But it is very, 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 very important that you test your blood sugar levels on a regular basis. So if you are a taxi driver, you need to test your blood sugar before you start driving, and every 2 hours whilst you are driving as well. Because the one thing we need to make sure, I think you're on mute, Fahad.
I said, regardless, whatever diabetic you are, like if you are a type 2 diabetic but on a higher range or a lower range because of your medications and because of your lifestyle, you have to test your blood sugar levels every 2 hours.
No, I said if you're a taxi driver. I'm talking about
Okay.
specifically taxi drivers. If you're a taxi driver, you need to test your blood sugar before you drive and every 2 hours whilst you're driving as well. Because one danger of diabetes is that sometimes if your blood sugar levels go too low, you can actually faint. You start sweating and you can faint, lose consciousness. So obviously, if you're driving a taxi, that is going to be very dangerous to you, your passengers, and people on the road as well. So this is why taking your blood sugar levels on a regular basis is very important, because then you can detect your blood sugar levels going low and you can do something about it there and then.
So can't a person who is a driver, taxi driver, put that device which on the arm where it gives you the reading like every hour, every other hour, something like that, and if the blood sugar is dropping?
I mean, unfortunately, those are not available for everyone on the NHS. Okay, those are not available for everyone. You can buy them privately if you want, but certainly, if you're a taxi driver, you are able to get the lancets and the strips and the blood glucose monitor from your GP.
Now, when we talk about diabetics, and especially when you are saying that testing your diabetes every 2 hours, I've seen that this kind of thing is quite common in some of our elders in our Asian communities, especially when they are about to have some nice mithai or meetha. They check their blood sugar and says, "Oh, I'm okay. I can have 2 gulab jamun." Is that correct?
It's not the wise way to go about things at all. I mean, you know the stories in our community whereby they have a bit more than they should, so they decide to increase the amount of medication they have on a dose by dose basis. And this way of managing your diabetes is not very wise, because what you're subjecting your body to are rapidly fluctuating glucose levels, where your glucose goes up and down very, very rapidly. And that is actually quite unhealthy for your body. So it is important to just try to stick to a good diet all the time. And as far as testing your blood sugar levels, I mean, okay, if your diabetes is not under control, it is wise to test your blood sugars just to see how everything is going. But if your diabetes is reasonably well under control, it's not wise to test your blood sugars all the time, because I tell people, if you start pricking your fingers all the time unnecessarily, you could be subjecting yourself to infections and things like that, and that's something else you don't want to do as well. So testing unnecessarily is not advisable.
In terms of people like a normal person who's not diabetic, who's absolutely fine, all okay, do not know anything about diabetes, do not have a history of diabetes, what symptoms or sign that person should be look out for to identify that he or she can be a diabetic person?
So the very early symptoms of diabetes are feeling very, very thirsty, passing a lot of urine, maybe feeling very, very tired and lethargic. And later on, what could happen is you could start losing weight as well. Those are the most common symptoms of diabetes, as well as developing rashes like in your armpits and your groins and places like that. Because when you are diabetic, you are more susceptible to fungal infections around your body. So, excessive thirst, excessive passing your urine, feeling very tired, lethargic, those are the most common signs, and these are little things to look out for.
So is diabetes preventable? Because one of the other things people do say is that, oh, my uncle has diabetes, my father has diabetes, my mother has diabetes, my chachi has diabetes, so I will become diabetic anyways, or my brother has diabetes, so I will have diabetes anyways, regardless what I do. Is it true?
Well, you see, you don't know for certain. You do not know for certain. But if you do not maintain a healthy lifestyle, if you eat the wrong food and you're overweight and you don't exercise, yes, you're going to be increasing your chances of having diabetes, especially if you're Asian. So if you think you may, if you have a family, like I have a strong family history of diabetes. I don't know whether I will get it or not. I don't know. But if I am going to get it, what I will definitely be doing is delaying the onset by maintaining a healthy lifestyle. So if you are going to get it, you can delay the onset by eating properly, exercising properly, maintaining the proper weight that you should be for your age, sex, and age, and just following a healthy lifestyle.
So in terms of when we talk about I'm talking about myths. So that's one of the myths which I've just discussed. One of the other myths which is quite common in our culture is if I stop eating sugar, I will not get diabetes, or if I start eating too much sugar, I will become diabetic. Is it true?
Again, that's not entirely true, because remember, we have hidden sugars in what we eat as well. So there are hidden sugars in rice, in roti, in pasta, and all sorts of things that we eat, in bread. So just cutting out sugars does not decrease your carbohydrate. You're taking sugars you're taking hidden sugars in other forms. And also, as I said, you've got to look at your weight as well, because weight is a huge factor in people becoming diabetic, especially in Asians. So you have to look at the amount of fat you eat as well. So, and again, exercise. Exercise is so key to all of this as well.
So in terms of one of the other things, people, our community is very, very lovely in many different ways, because they always have taught case, like a small fix, quick fix kind of thing. One of the things people think that diabetes is not dangerous. All I have to do is just eat little bit of sugar to control the high sugar. So if how can that be possible?
Well, that's not possible at all. Again, it's so important to read the information. And in these days, we are so lucky. There is information everywhere, as long as you go to the right place. As long as you go to the right place, there's information everywhere. And the Diabetes UK website is amazing, because not only does it give you information in English, it gives you information in Urdu, Arabic, Chinese, every single language, and it will give you diets for almost every ethnic group that I know. And they really have gone out of their way, because they realize how diverse our community is in the UK now. They really do realize how diverse. So they are absolutely amazing. This website, just go onto this website. If you're worried, it'll give you all the tips, all the advice you need to know.
So guys, if you have any questions or queries, please get in touch with us. And we have Dr. Adil Ali-Khan with us for the next 10-15 minutes. So please, if you have any questions or queries regarding the topic diabetes and our community, please give us a call. Really, please send us a message or text message. 9481822. I repeat, 0779 481822. So, Doctor, one of the other things people think that if we do yoga, or if we do proper yoga exercises, that can fix diabetes as well. Is it true?
No, not at all. Not at all. Yoga does not cure diabetes, does not fix diabetes at all. It might help. Yoga has a part to play in helping you relax, keep your body supple. It has a very, very important part to play. But as far as diabetes goes, no, not at all. Not at all.
One of the other things people do say is that I have a very frequently trip to toilets. Is that means I have diabetes?
I mean, passing urine a lot is one of the symptoms of diabetes for sure, but there are many other illnesses that can cause this apart from diabetes. Definitely, if you are passing a lot of urine, yes, I think you've got to be. Diabetes is one condition that you have to exclude, but there are many, many other conditions that can cause this as well. So it is very, very important to consult your doctor, and he'll do all the relevant tests and find out what the underlying cause is.
And there are some people think that diabetes can be fixed by alternative implants or surgical treatment. Is that true as well? Which sometimes you see adverts on that you implant something and it will cure your diabetes.
Well, there aren't any implants that are going to cure your diabetes, but what we have available these days in Luton is the bariatric service at the Luton Dunstable Hospital. So if you're diabetic and you are severely obese, you can be referred to this particular department at the Luton Dunstable Hospital, and they will help with your weight loss. Now, there are certain people who are very, very overweight, markedly obese, and we have found in those people, if they have what we call bariatric surgery, that's operations on their stomach to reduce the size of their stomach, that sends their diabetes into remission. And it does work. It does work. It is a huge operation. It is a drastic operation. But certainly I know of at least 10 patients of mine who've been through this program, who have had the surgery, and it certainly has been life-changing for them. And they have managed to come off their diabetic medication totally.
Wow. So that means it does work. In terms of the education, when we talk about the education wise, is there any education program where patients can go and learn about how to manage their condition of diabetes?
Yes. So once you are diagnosed diabetic by your doctor, he'll refer you to a department in the community called Desmond, and this is this is an organisation which literally talks to you about the diet that you should be following. And they do have classes for Urdu speaking, Bengali speaking as well. So if you do not understand English, if you just understand Urdu, or you just understand Bengali, they will have classes for you specifically. What I always tell people, if you go along to these classes, if you're not the cook in the house, take the cook along with you, because they're the ones who've got to know exactly what to be cooking for you. Otherwise, you very often find that Mr. Khalid goes along to the course on diabetics, and he comes back and he hasn't really taken much in, and he doesn't do the cooking in the house. So what's the use? What's the use here? So
Well, Mrs. Khalid
always take the cook in the house with you.
So Mrs. Khalid should be there with Mr. Khalid. Yeah, exactly. Because sometimes you need to do a very fine-tuned changes, small changes with one step at a time, and next thing you know, your cooking style has been different. You are taking less and less oil and other stuff into your food, and you don't feel much difference in terms of taste, and sometimes tastes better, isn't it?
Absolutely right. And listen, what you need to be doing is not just educating the individual, you have to educate the family as well. Because, when my father was diagnosed diabetic, it doesn't only affect him, it affects all of us. Because it's a lot easier for him to change his diet if we all change our diet slightly and help him in that respect. So, if the family get involved, if the family grow their knowledge about the illness, it will help the individual who is diagnosed as diabetic as well.
So, Adil, as you see patients on a regular basis, you are still in surgery. I can see in your GP surgery at the moment, you're sitting in your consultation room. So you see patient on a daily basis, in fact, hourly basis. Will be a better rectification of the words. what is the patient journey and experience, and especially the ones who are diabetic, how they come to you, how they express their words, how they explain themselves?
Well, very often when I talk to a patient and I tell them they're diabetic, you can see the effect it has on them. In most cases, their jaws drop, and they feel it's almost a death sentence. And it doesn't have to be a death sentence. It does not have to be a death sentence if you take responsibility. If you take responsibility, it does not have to be a death sentence at all. If you follow the advice that we give, and as doctors, as GPs, we are all there to help, and we do want to help. We will bend over backwards to help you, but you've also got to help yourself as well. So very often you find that there are a group of patients, and most patients, they follow the advice, they listen to everything you say, they take the initiative themselves, and they do, and by and large, most patients do very, very well indeed. However, there are a few patients who bury their head in the sand, and they just do not take your advice, and they carry on doing what they want to do. And these are the patients where you see things will start to go wrong down the line. Very often, I look at the repeat prescription list of my patients, and I find that, listen, I say, Mr. Khalid, you haven't taken your diabetic medication in the last 6 months. And he'll say, nay, I've been taking it every day. And I know he hasn't been taking it every day because I can see he hasn't taken any prescriptions for us. And, you really, really have to hammer home to how important it is to follow the instructions, because you can't take these things lightly. You cannot take these things lightly. Because I said with diabetes, when things go wrong, chances are they're irreversible. That means you cannot mend them.
Exactly.
So why not be proactive and do something about it in the first place?
Definitely. And Adil, just for our listeners who speak Urdu, thoda Urdu mein message ho jaye, because the time has passed really quickly. We just have a couple of minutes before the end of the show.
All I can say is, look, diabetes
Urdu
illness, ये बहुत important है, ये बहुत serious लेना है. अगर ये serious ले तो आपका जिंदगी you'll manage just fine. But अगर ये seriously नहीं ले तो आपको बहुत से illnesses हो सकते हैं. You can get heart attacks, you can get strokes, you can go blind, your kidney function can suffer, you can lose your limbs. This is how serious it can be. This is how serious it can be.
And how what are the exercise and diets they can do, you said?
Well, look, exercises, you don't have to join a gym. You don't have to do these things. What I tell my diabetic, just go for a walk 3 or 4 times a week, go outside, go for a walk, start with a quarter of a mile, then work up to half a mile, then work up to 1 mile, but make the walk a bit testing. What I tell my patients is, look, थोड़ा सा तेज चलना पड़ेगा आपको, थोड़ा सा पसीना आना है, आपका दिल धक 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 मारना है. Because when you're sweating and when your heart is beating, that is when you're exercising. That is when it's going to do good for you. You don't have to be out of breath totally or anything like that, but challenge yourself, set yourself milestones. But the most important thing is to do it. That is the most important thing, to do it. Just go for walks, healthy walks on a regular basis, and that'll be good enough. That'll be good enough. You do not have to join gyms. You don't have to go out running or anything like that.
Indeed. Thank you so much, Adil. Thank you so much for your lovely advices, and definitely thank you so much for joining us in this show and giving such a lovely advice and guidance to all
It's
our
always a pleasure. And listen, it's a privilege to be working in Luton. It's a privilege to be serving the community over here, because I tell you something, Luton is a fabulous place with fabulous people, and with our projects in the community, we can and we do make a difference.
Indeed, definitely, inshallah, we will make a difference. Until next week, remember us in your duas, and we will be back after next week again, same time, same show. If you have missed any of these shows, our show is available on Facebook, so please go and back and see it. Thank you so much, Adil. Assalamu alaikum.
Thank you very much. Wa alaikum assalam.